Hi, good afternoon, everyone. My name is Jeff Cooper, Health Commissioner for Public Health Dayton, Montgomery County. Thank you for coming today. It's been a while since we've had a news conference. I think our last one was May 12th, and so a lot of information has changed since then, and we want to make sure that we effectively communicate that updated information to our respective communities. We're very fortunate today to have other individuals here with us to present information. So we have Melissa Howe, Health Commissioner for Greene County Public Health. We have Dwayne Stansberry, Health Commissioner for the Warren County Combined Health District, and then Mayor Nan Whaley again from the City of Dayton, and Sarah Hackenbrack, not last and certainly not least, President and CEO of the Greater Dayton Area Hospital Association. So thank you everyone for being here today. So a lot has happened over the last month or so. I think we all are staying abreast of the national news and the increase in multiple cases throughout the country. We're aware of the situation statewide in Ohio, and specifically for those that were participated or listened in on the news conference today with Governor DeWine, you heard that there are various areas in the state where we're starting to see more of a significant increase in cases, and we'll talk about why that is. So when we were here last on May 12th, we reported 433 cases within Montgomery County. We are now at 1,118 cases. So that's about a 150% increase in cases. And if you look at the West Central Ohio region, the 8-county West Central Ohio region over that given time frame, it's about a 125% increase in cases. That's not unanticipated. That's what we expected, and we had been saying that all along at our news conferences. As we got into Responsible Restart Ohio, and as testing capacity increased, we indicated that we would be seeing a significant increase in COVID-19 cases. I think one of the things that concerns us the most as a health department is the disparity in outcomes regarding those tests by race. So for example, right now within Montgomery County, we have basically, if we convert those cases to a rate, we are at 1 case for every 556 Montgomery County residents. But when we look at that by race, we're at 1 case per 347 black individuals, and we're at 1 case per 866 white individuals. So clearly, we have a racial disparity in testing outcomes among races. And that's something that concerns us as a health department because it's consistent with so many other public health conditions and issues. And so it's a common theme around minority populations and disadvantaged communities. And as a health department here in Montgomery County, we're moving forward to identify how do we do better outreach to those type of communities to where we can make sure that we're getting individuals tested and we're getting them linked with care. So I think it's also important to note that because we're seeing this increase in cases, that's not just because of testing. That's because individuals are circulating more as the economy has reopened. So it's not just testing. It's individuals are going to more gatherings. Oftentimes individuals are not social distancing, and oftentimes individuals within the community are not wearing a facial covering. And so all of those factors lead to this increase in cases that we are seeing. It's also important to note that within the last week or so, as we start to see more cases, we're seeing more severe outcomes among patients. And so I know Sarah Hackenbrack is here today, and she can talk about some hospital data associated with hospitalizations. So, just a second here. It's been a hectic day. So let's talk a little bit about where we are seeing outbreaks. Keep in mind that we have an information line, and we've received almost 8,000 calls to that information line since this pandemic began. Many of those are just general inquiry, many of those are just give us information or tell us more about the disease, etc. But some of those are complaint-based, and we've talked about that over the past months of how we as a health department are responding to those. When we start to see a significant number of calls pertaining to any one particular entity, that kind of gives us pause for concern. And then as we identify cases reported to us based on laboratory results, obviously we begin our investigations. So we have, since April, we have identified 13 what we would call clusters or outbreaks at various locations within Montgomery County, because we know we have community spread. So I'm going to share with you those locations. Governor DeWine mentioned a few today, but we'll share with you what those locations are. This is not indicative of those facilities alone, and this is probably just the tip of the iceberg. We're going to see more and more clusters or outbreaks in other organizations and businesses. But to date, we have responded to outbreaks at the Community Blood Center, Hospice of Dayton, Respiratory and Nursing Center of Dayton, Sugar Creek Brandworthy Food Solutions, Crocs Distribution Center, Energizer Global Auto Care, Chewy Fulfillment Center, Franklin Iron and Metal, Minerva Bunker Gear Cleaner, Friendship Village, Fuyao Glass, St. Leonard's Living Communities, Dryden Road Pentecostal Church, and the Montgomery County Jail. So obviously we're doing our part around case investigation and contact tracing, and we'll continue to move forward to protect our community. Again, it's not indicative of those facilities. They are not alone. We will see more cases, and we will see more outbreaks and clusters at various businesses and organizations. So I think the key message then to leave for our community is that recent data indicate that wearing a face covering is perhaps more effective and more important than just the physical distancing. Yes, social distancing is important, but we're going to ask all individuals again to use this information, make an informed decision, and when you're in the public or frequenting a store or a restaurant, please don a face mask. We all understand that employees of businesses are required to wear a face covering. It's optional for customers unless the business requires it. And certainly businesses can revisit their existing policies and require customers to wear a facial covering. We would strongly recommend them to do so. We will continue to update all of our information, place it on our website, and then continue to expand our testing capacity within Montgomery County. So that will include, the testing capacity increase will include congregate care locations or living facilities, correctional facilities, the jail. It will include the hot spots or, quote, outbreaks within businesses, and then we'll be looking at setting up community sites, especially in disadvantaged communities, to make sure that we are addressing inequities in health and responding to the racial disparity in cases that we see. All right, so that's a quick update for Montgomery County, and with that, I'd like to introduce Commissioner Melissa Howell from Greene County. I'd like to introduce Administrator Noah Stubby from Greene County.
Good afternoon, everyone. As you can see, yes, I'm not Melissa Howell. I'm Noah Stubby. I'm the Deputy Health Commissioner for Greene County. So this afternoon, I'll give an update with what's been going on in Greene County. A lot of what I have to say echoes, in a large part, what Jeff has already reiterated due to factors that have increased case spread, and a lot of that, again, will be much of the same. So our focus continues to be on COVID case identification, contact tracing, and the distribution of PPE. We have worked very diligently to make sure that all of our jurisdictions and our first responders have all received their PPE caches. We've been able to do that. We have not had any first responders test positive for COVID-19. We are also committed right now to ensuring that we're dispelling any myths and making sure that the right information is being disseminated so that those individuals can make the best decisions for themselves and for their families. Right now, we're encouraging businesses within our community to follow the low-cost and common-sense methods to ensure, again, safety of their employees and safety of those who are entering their businesses. Right now, our hospitals have capacity Should that capacity be called upon, it is there. Testing is happening within the community. Again, we have the capacity to find those cases and to identify them through contact tracing. We are considering displaying zip code data, but those persons that are currently positive cases are no threat to those in the community. They're isolated and are not out. Currently, we have 58 active confirmed cases, and since June 1st, we've had 44 new cases. Again, a lot of that increase has to do with people are now out circulating more. They're doing more of those things that they enjoy. Spread is happening within families. And then again, with increased capacity in testing as well. We have also developed a hotline. That hotline is used to allow individuals within the county to get answers to questions that they may have, such as where can they get testing done, what should they do to protect themselves, and things of that sort of nature. We too are also encouraging social distancing. Mask usage are definitely messages that we continue to push. We will also be having a pop-up testing center, as you've already heard from the governor's address. It'll be next Wednesday, the 24th, from 9 to 4, and that will be occurring again at the Greene County Health site. And that's pretty much my update for Greene County. Thank you.
I'd like to now welcome Dwayne Stansberry, Health Commissioner for Warren County Combined Health District.
Good afternoon. Thank you for inviting me. Just as the previous two health commissioners have talked about, we have been seeing some increases in the cases in Warren County. We've been seeing them for several weeks now. We've been sending out more information to the residents in Warren County to make them aware that we are seeing these increases and that the COVID pandemic is not over at this point, that they still need to continue to do all the safety measures, precautions that have been mentioned before, the mask wearing, social distancing, staying home when you're sick, and we continue to inform the Warren County citizens of those concerns and things that they can do to protect themselves. We have seen our cases have gone, essentially have doubled over probably the last 3 to 4 weeks. They have doubled over what they had been in the previous month or so before that. So they've gone from, we were typically seeing 3 to 5 cases per day, and now we're seeing anywhere from 10 to 15 cases per day. We're up to about 549 cases in Warren County, and we do see, as we look out into our community, we see more and more people out in the community. You know, the weather's been nice, and so again, we're pushing that message that yes, you can go out and enjoy the outside, but you need to take all the precautions of wearing a mask, social distancing, you know, and we try to focus on what each individual person can do, what each individual business can do, or community organization, is reduce those risks. We let them know that there's no such thing as zero risk, whether it comes from COVID or the flu or any other thing, but there are many things you can do to reduce those risks, and we help them to focus on what they can do to lower those risks. As businesses started opening in Warren County, again, we focused on what can you do to reduce the risk for both your employees and the customers that are coming into your business, and do everything you can to get that risk as low as you possibly can for those folks. We are seeing more community spread, which means it's not just happening in businesses, it's not just happening in churches, it's happening, we see it from family gatherings, we're seeing it in funerals, we're seeing it in other areas where people are getting together, that's where we're starting to see some spread happening. Again, we're going to continue to work with as the governor continues to open up businesses and other things in the state, we will continue to work with those groups, those businesses, to help them learn how they can best reduce those risks to their employees and again their customers. And we will work with our community on how to get additional testing. We did talk with the state. We don't have any of the pop-up testing happening in Warren County yet, but we do know that we will be working with them, and we do know that that will be happening probably in the next several weeks in Warren County. So, thank you.
Next, we'd like to welcome Mayor Nan Whaley to the podium.
Well, good afternoon. I can't believe it's been about 5 weeks since we've been here. And I don't think, as Commissioner Cooper mentioned, we're not very surprised by this increase in the number of cases going up, particularly because we've seen, particularly because we see people moving around a lot more. And I think anecdotally, we're also seeing less and less people wear masks and really not following social distance protocols. I'd also want to point out that the 3 zip codes the governor pointed to today, two are in the city of Dayton. One's Dayton-Huber Heights, and the other one is Trotwood. And so just like we're seeing some of this racial disparity on the overall people that are getting COVID, we're also seeing it in the communities that they're living in. So we'll be working with the governor's office and with Ohio Department of Health to do some pop-ups to do no-cost testing. Now, I want to be really clear, too. I think there's something else that has significantly changed from the past 5 weeks to now. And really, anybody can get a test. Tests that are really all over the city now, from Rite Aids and CVS pharmacies to your local physician. Anyone can really get a test, and we'll have more sites that people can go to and make sure that we'll publicize them, because that has changed. Before, if you remember, we stood here for months and we said, if you don't feel good, just stay home for 14 days and weather it out, assume you have COVID. But now we are saying, please, go get yourself tested. You don't feel well, or you've been around someone who you know has had COVID, go get yourself tested. It's a great way for us to be able to track this and make sure that we keep our community safe. That is a really big change from 5 weeks ago. So we're encouraging people to go get tested. The other thing I'd like to just talk a little bit about is just the fatigue around this disease. It's been over 100 days that we've been asking people to not go to events, not go to places. I like to think of it as, is it the event worth you getting COVID? Because that is what could happen, because we don't know where this disease is. We can't pinpoint it and put it in a little circle and it be done. So that's the way I ask every question that I go to an event. Is it worth me getting COVID to be at that event? And I would guess that probably the majority of the time we'd say no, and we'd stay home with our family and be safe. Okay, I want to also recognize that we are going to be in this phase for probably at least another 100 days. So think about the opportunity as we see how medicine is making amazing strides every single day on this disease. Every single day we learn something, how to keep people alive through it, serums, efforts around treatment, but also how we get closer to a vaccine. So we need people just to keep on holding on, because the longer you hold on this, it's not like it's forever. We are getting medical efforts that are looking really great from all sides of this conversation, but we can hold on longer to keep people safe and make sure that we keep our community safe. I think Commissioner Cooper's also made the point, and Public Health made the point, is this is, we've seen before that it was just, I think thought of that only senior citizens need to really worry about this. We're seeing upticks in every single age group now, so it is moving through this community, and it's moving pretty quickly. So really, my encouragement to you is think if you really need to go to that event. Is it worth getting COVID if you go to that event? Do your best to stay home, stay in your backyard, take walks, keep distance, and please, please, wear your mask. The mask is showing more and more how effective it is. The more studies they do, the more they realize it protects a lot more than they thought from the beginning. So the people that are wearing masks when they're in public spaces, they're being very smart about my health and their health. So those are the things that we think are really important today. Appreciate you coming forward. Appreciate the great work that Public Health has been doing and the hospitals. It's been They've just been completely terrific, but we want to be honest about what we're seeing in our community. We think it's important that we tell our community what's up and that they do their part to keep themselves and their families safe. Thank you.
Thank you, Mayor Whaley. Next, we'd like to welcome Sarah Hackenbrack from the Greater Dayton Area Hospital Association.
Right. Thank you, Commissioner Cooper, and to our fellow health commissioners from across the region. Appreciate everyone being here. Mayor Whaley, thank you for your continued leadership and advocacy. It is important to recognize that 5 weeks ago, we were still working through where our hospitals were and what they could do here in this community. And I'm pleased to report that our hospitals are open and safe and operating under a new normal that allows us to live with COVID-19. Those surgeries that were postponed or delayed because of the governor's executive order are now being scheduled, including those that allow or require an overnight stay in the hospital. Because of that, it is so important to remember, don't delay the care that you need. If you are someone who couldn't get the surgery that you needed, get that scheduled with your provider. If you're someone who's experiencing a crisis or an emergency, seek out that care at the emergency department. A couple of the things that our hospitals are doing differently in this new normal for us is really managing our emergency departments with a couple of new tools. One of those being something called split flow triage, which allows our hospitals to safely separate those individuals who come into the hospital for routine emergency services and those who may be symptomatic of COVID-19. That allows us to ask them questions and screen them to make sure that we can isolate those individuals safely and keep the population that is potentially positive of COVID-19 separate in the emergency department. If you're going for routine care, it is also important to recognize that things may be a little different than what we are used to. So when you go to your provider, you might be asked a series of screening questions that ask you about your temperature and any symptoms, and they may in fact also use what's called a non-contact thermometer to screen you for your temperature. If you are waiting for your appointment and you're waiting in the waiting area that we're used to going and sitting in, looking at a magazine, those magazines probably won't be there anymore. And the spaces in the waiting room will be distanced approximately 6 feet apart to keep everyone safe and physically distanced. If there isn't a waiting room in that space, you may also be asked to wait in your car, and then you would be called to come in for your appointment. And those are just some of the items that our hospitals and our healthcare providers are doing across the region to make sure that we are helping our community live with these guidelines that we've received from public health. For your routine care, it is so important to remember, now is not the time to delay your appointment with your cardiologist. Keep that appointment. If you are a new mom or planning to become a new mom, keep your prenatal appointments, keep your necessary women's health appointments, keep your mammogram appointments so that we can detect things early instead of waiting and finding that your care will need to be much more intensive later on. If you're a parent, please keep your child's pediatric appointments. Keep them on their schedule for their well child visits and their vaccinations. That is going to be so important for their overall health in the long term, in addition to managing what may come with COVID-19. And as all of our health commissioners have discussed, testing is so important, and our testing is increasing here in the region. And as we test more people, we discover more community spread outside the walls of our hospitals. This is happening in our communities, and our public health partners are so important in helping us find these cases and then understand through contact tracing who each of these individuals have come in contact with, where they might have been in their community, so that we can again isolate and really help make sure that we're limiting that spread as much as we possibly can. If you test positive for COVID-19, please monitor your health, follow the instructions for your doctor that your doctor has given you, and make sure that you do not delay care in an emergency. We are seeing individuals come into our hospitals who have COVID-19 who've waited to seek that care, and they are sicker than what they need to be. And so if they'd gotten into emergency care sooner, they wouldn't need to go into the intensive care unit. They wouldn't need to be serviced with a ventilator. Those are all things that we can do here in this region, and our hospitals have phenomenal care. They have the availability and space in our intensive care units, and they have the ventilators that our community needs. But if you wait, you may again make this situation with COVID-19 even more difficult for yourself and for your body to recover in the long run. I really want to make sure that we emphasize what Mayor Whaley has said and what Commissioner Cooper has said is the best option for us as a community is not to test the resources of our public health department and our hospitals by increasing the spread of COVID-19 unnecessarily. We still have to learn how to live with COVID-19 here in this community. And that means following all of the instructions that we have heard today. Wash your hands for 20 seconds with soap and water. Remain physically distanced of at least 6 feet away from those people who aren't in your immediate household. And wear your mask. The mask helps you protect other people in your circle and in your environment, because we don't all know the status of the health of the people in our grocery store, at our pharmacy, at the gas station, or even at the garden center at Lowe's. And so it's a kindness and a demonstration of respect for those people in our community. Thank you.
All right, thank you, Sarah. So that concludes our formal presentations, and we would be happy to answer questions.
How frequently you're seeing unlinked cases where you can't tell the link of where they got sick from versus how frequently you're seeing cases that go linked?
I don't know. So the question is, can we tell how frequently we're seeing unlinked cases versus cases with a link? If you look, let me see here. If you look at our combined cases to date, 1,118 for Montgomery County, we have about 173. This isn't most to date, though. We'll have a better idea probably in the next day or so. Probably around 200 of those cases are linked to an official outbreak that we have been investigating. Yeah.
For these places that have been identified, the 13, what changes are they being asked to make to stop this spread, or are there any?
So certainly, we shouldn't assume that they're not complying with the requirements for their sector. It's just this virus. Nothing has changed about the transmissibility of this virus. It spreads predominantly by respiratory droplet and aerosol. That's the predominant method. However, it can also spread by an individual touching a contaminated surface and then touching their mouth and nose and eyes. However, we shouldn't assume that these businesses that we've identified are not taking the appropriate cautions. It's just this virus spreads very rapidly. So as we do our case investigation and our contact tracing and we work with those businesses, we just make sure we reinforce what they should be doing in terms of the checklists established for that sector. Any comments from Warren County or Greene County additional to that you'd want to make, Commissioner Stansbury and Deputy Commissioner Stubbe? Come on up.
Yeah. I would just add, especially early on when we started seeing some outbreaks in the long-term care nursing facilities, that we would communicate with the owners and operators of those facilities and do what's called a tele-ICAR, which helps them to figure out ways to isolate and separate the folks that are in the facility that are sick or employees, how soon they can let the employees back if they've been tested positive. We also, show them ways that they can reduce the risk to the healthy patients and living in the nursing home, and separate them from those that have tested positive, and helping them do some of the mechanics and the physical changes inside how they keep folks in those homes to increase the ability that that they won't become sick and reduce the risk of them being exposed to something.
In Warren County, is there any specific place or places that maybe you guys have noticed more cases and that's where it becomes troublesome?
Well, I'm sure like most places, we see the higher number of cases are in the 4 cities in Warren County, and that continues to be the case. And as you get into the suburbs or the countryside, there's not as many cases, and we continue to follow that. I mean, obviously, the more people you have together, the more likelihood of the spread of the disease.
I would just make one small comment for Greene County. Largely, it's our environmental health team is involved in the compliance with answering the questions and the business standards and whatnot. So essentially, a lot of what we're doing is just helping businesses follow the guidance set forth by the governor and then CDC recommendations, and we work alongside them to help them implement whatever plans or safety protocols they're thinking about doing. If they have those questions, we're certainly acting as a resource for them. And then as other individuals and other entities have questions about possibly hosting events or any kind of practices for their own individual facility, we're more than willing, and we have reviewed their plans. They can send them to us and we'll review them, make our recommendations, and send them back.
When it comes to free testing and everything, what are the plans for that? When can we see it happen?
So the question was when, regarding testing and free testing, the plan for that, and when can we see it happen? So we were on a conference call this morning with the governor's office and our regional partners. You know, the governor referenced that Montgomery County, Warren County, Greene County, and Clark County are seeing an increase in cases. There's also an increase in Hamilton County. And so we are convening a series of calls tomorrow with our partners, including Dayton Children's Hospital, to make sure that we have a consistent plan in place regionally that will identify those community testing locations, and then we'll communicate that to our citizens. So in the very near future, we'll release that information once our plan's complete, and we'll make sure that that's communicated effectively to our citizens, because there's no reason why someone should not be able to get a test right now. So we'll continue to expand our testing as needed in congregate care locations. We'll continue to do testing in these outbreak areas or clusters, and then expand community testing locations throughout Montgomery County and our other counties as well. Yeah. And I think it's really important that our counterparts from our other health departments near us were here today, because this isn't an issue that just affects Montgomery County. It affects every county in our region and every county in this state. And we wanted our citizens here and your citizens to hear directly from them. So I think it speaks volumes to the fact that as a region, we've always collaborated together. And I'd like to thank Commissioner Stansberry and Deputy Commissioner Stubbe for being here today from Greene County to communicate to their citizens as well as Mayor Whaley here, always providing an important update, and Sarah Hackenbrack from the Greater Dayton Area Hospital Association. It's our intention to continue to do whatever's necessary on behalf of public health to make sure that we protect the health of our citizens. And I think as a region, we've demonstrated that we rapidly identify cases, we do contact tracing, we isolate individuals, we quarantine close contacts, we're expanding testing, we're doing the public information and outreach, we're doing everything within our power to communicate with our citizens, including posting all of the information on our respective websites to make sure that individuals have the information that they need to make informed decisions.
Commissioner Cooper.
Oh, there's a question.
Have somebody on the phone. Go ahead.
Yes.
Yes, this is Fraser Smith at Channel 7. Can you go over that list again of the 13 clusters?
We'll send that out.
Yeah, we provided it to your photographer here,
Yeah.
so I'll resend it out to the media list after this call.
Okay. All right.
And I think the key message there is that it's not just about those locations. It could happen anywhere. And so I think the important message is that regardless of the county, local public health in collaboration with our hospital system partners, our public safety forces, as well as our mayors and managers are doing what's necessary to protect the health of our citizens. So please don't focus just on those businesses, because it could easily happen at a restaurant, a big box store, or any other location.
Thank you.
Yeah, you're welcome.
And I have a question for Sarah. With the number of cases going up right now, what are the hospitals doing to kind of prepare for a possible increase in patients?
So we are continuing our ongoing collaboration and conversations, working with emergency preparedness staff, infection control staff, as well as our operations leaders, and consistently monitoring on a very regular basis the capacity of our hospitals and how that dovetails with what we're seeing in the community in terms of an increasing number of spaces or cases throughout the region. So right now, consistently monitoring, and then we already have triggers in place for each of our institutions as they build and increase their capacity internally.
And you mentioned if someone is feeling sick, it is important for them to go to the doctor. I can imagine that would also be so, because you said you don't want it to get worse, and then the ICU could fill up, and that's problems for everybody.
Correct. So we really want people to be proactive with their health, whether that is for COVID-19 or for any of your traditional routine care that you've needed to manage. If you are someone who underwent heart surgery a couple of years ago, or if you're someone who needs to manage your diabetes care, it's really important that you continue to manage those in concert with your doctor, so that when you do need to seek care, you're not going in for a situation that has been made even worse because you delayed care. Okay.
If a business or an organization has a case, will public health proactively reach out to them, or should the organization get in touch with their public health department for information?
Okay, what was the first part of that question?
Like if a business or organization has a case, does public health reach out to the organization, or should they reach out to public health to try to get some guidance?
So the question was, if a business identifies a positive case, should they reach out to public health, or should we be? So actually, we will receive notification of all positive cases within our respective counties, and then we would begin that investigation. Anything you want to add to that, Dwayne?
Yeah, I would agree with Commissioner Cooper, but we also have had several cases, outbreaks that, it's sort of reported on where that person lives. And so it could be, we've had some where they live in Warren County and work in Montgomery County, or vice versa, where they live in Montgomery County and work in Warren County. And so that's why I'm grateful to Commissioner Cooper for inviting us up here. Our teams have worked very well together, and we continue to do that. Same thing with Greene County and Hamilton County, Butler County, all the other counties that surround us. We know that it's important that COVID doesn't know county borders, and we all have to work together.
I've seen in other states some health officials giving guidance to folks who were in protest to maybe consider getting tested. Is that guidance that is being given out in Ohio?
So the question is regarding guidance to individuals who are participating in protests, whether they should be tested. Certainly that's an individual decision. We are very concerned with any type of large gathering, the potential for spread of COVID-19. So it's not just a protest, but any large gathering. Let's face it, we're all hearing that as the economy reopens, it's now you can have a maximum capacity in the grandstands at a fair of 2,500 individuals. Or you might have 3,000 to 5,000 people at a splash park or an aquatic center, etc. So all of those locations, we're concerned about the spread of this virus. and it's ultimately then each individual that needs to monitor their symptoms and respond quickly in the event that they become symptomatic, or even if they want to get a test, because it's now, there's no limit per se on testing. That's why the governor has expanded priority group 5 to say that even asymptomatic individuals can be testing, and that's why we're going to be setting up community sites for individuals to do that testing. So it's all of those congregate, large gathering type locations. There's the potential, much more potential for spread of the virus, as opposed to if individuals limit their exposure around large crowds.